Hi, good day everyone. My name is Elia Kim and I'm here to present to you the policy development and implementation. So, as an advanced practice nurse provider, many of us diagnose, treat, and manage our patient through telehealth. And it is increasingly nowadays, and also with the support of artificial intelligence. But here's the concern. The concern is what happens when the technology we rely is unregulated, biased, and misunderstood. Today, I will present a policy addressing a critical and emerging issue, which is the lack of a standard or a lack of standardization regulation for AI assisted telehealth in APRN practice. So, for the problem statement, telehealth and AI are rapidly transforming healthcare delivery system. And nowadays, most of us nurse practitioners and providers are using AI-driven clinical decision support tools, remote monitoring tools, and telehealth platform for diagnosis and treatment. However, there is no comprehensive, unified policy that governs how these tools should be safely and ethically used in APRN practice. There's lots of research shows that AI system can introduce algorithmic bias affecting diagnosis and treatment decisions. And also, telehealth regulations are it varies of which state are you practicing with, and it creates or inconsistently in nursing practice, especially in advanced providers. And most APRNs are often left relying on general ethical guidelines rather than clear policy. And these gaps create a dangerous between the technology and the policy oversight. So, little background of AI and the telehealth, which has been rapidly expanded during the pandemic, last way back 2020, and many restrictions were temporarily lifted. And then, while this has been improved, the access it led to some fragmented regulations across the state. And also, it increased the reliance of the practitioners into digital tools without standardized oversight, wherein the growing integration of AI into diagnostic workflow. However, there's some scholars emphasize that current healthcare laws were not designed for AI, especially in assisting or supporting clinical decision making, especially in and also when it comes to um, advanced practice nurses, because um, APRNs takes more on autonomous role, wherein the gaps between uh, technology and the policy or clear policy is being or having more significant. So here's the proposed policy and as an APRN. So there is an proposed that APRN Telehealth and AI Safety Act, which includes uh, four key components, which is the standardization of AI oversight guidelines, which establish a national standard for AI tools that is being used for diagnosis and treatment, a mandatory APRN training in AI and telehealth, because we have a lot of because of this AI emerging rapidly in healthcare. We need to cope up. We need to train. We need to be trained. How are we going to use it properly? And also, the third key component is bias monitoring and reporting system. So healthcare organizations must track and report disparities in AI assisted care. So because we know that we don't know how are we going to report properly without biases. And next is the interstate practice alignment. So it means that the APRN licensure, it comes here the compact, the APRN compact. It ensures to have a consistent telehealth practice authority across the state. It's not only limited into a certain state. So that's another problem that we need to look at it, and that's one of the key component in this proposed policy, so that there will be a consistency of care across the state. So stakeholders and stakes, of course, it is still it directs impact the patient safety and quality care. And the stakeholders includes the of course the nurse practitioners, patient, healthcare system itself, and the administrators, the one in people in the technology developing AI and telehealth companies, and of course the state and the federal regulators. Because without this policy intervention, we are risk for inconsistency, care, diagnostic errors, and widening health disparities. So for the implicit values, the policy is grounded in key healthcare values, which is number one, patient safety. That's the number one rule, of course, in diagnosing and treating our patients. And second is equity. So it reduces the disparity in healthcare delivery system. So it means that we can also serve underserved populations and those who are in the minority group. Third is the professional autonomy, which supports the APRN independent practice, and then the accountability because of ensuring safe use of emerging technology. However, the ethical consideration of this is bias in AI may lead to that misdiagnosed in a minority population, lack of transparency, which limits patient informed consent, and over reliance to the technology, which weakens the clinical judgment of the nurse practitioners. And it is beneficial as well. This policy is beneficial for patients for through safer and more equitable care and more accessible. APRN, of course, for us to have a proper providing clear guidance and reducing legal ambiguity, and healthcare system in improving quality and consistency, and also it will benefit as well the rural and the underserved communities for better health access. And the economic impact, because of this, there's both a short and long term effect. The short term is training program costs, AI auditing and monitoring. However, for long term benefit, it will be reducing the misdiagnosis and malpractice risk, improve efficiency in care delivery, and a better healthcare outcomes, reducing overall healthcare costs. And for the expected outcome of this policy, if this is implemented, it will provide safer integration of AI in APRN practice, reduce healthcare disparity that links to bias algorithm, greater consistency across the state, and improve patient outcomes and provider confidence. In short, it aligns in modern technology with safe, ethical nursing practice. Um, but innovation without policy creates risk. So by establishing clear standard for AI and telehealth use, we can ensure that technology enhances and not compromise patient care. So the future of healthcare is digital. So this policy ensures safe, equitable, and guided by nursing excellence. Thank you.